Hello, everyone. I'm Donna McKay, the Executive Director of Physicians for Human Rights, PHR. Today's conversation is the 29th in PHR's COVID-19 themed webinar series, which since launching in March has been examining the implications of the pandemic through the lens of health and human rights. We have more than 500 people live with us for today's conversation. As our world continues to grapple with the challenges set forth by the COVID-19 pandemic, international health institutions such as the World Health Organization have played an absolutely critical role in guiding COVID-19 response internationally and at the country level. The WHO has sent teams of response coordinators and epidemiologists into countries, established online courses to train health professionals in diagnosing and treating the disease, as well as published a significant amount of COVID-related public health advice on issues ranging from diagnostic tests to the public use of masks. And amidst all of this, on May 29th, President Trump announced that the United States would terminate its relationship with the World Health Organization by July 2021, cutting off one of the largest sources of funding for the agency in the middle of a global health emergency. Today, our panel will help us understand what US withdrawal from the WHO would mean for the global community and what consequences it could have both in the United States, but also globally. As today's expert panelists so aptly wrote in a piece together for the medical journal, The Lancet, in August, withdrawal from WHO would have dire consequences for US security, diplomacy, and influence. The USA cannot cut ties with WHO without incurring major disruption and damage, making Americans far less safe. That's the last thing the global community needs as the world faces a historic health emergency. So to moderate today's conversation, I'm thrilled to introduce Dr. Rupa Dutt, Executive Director and co-founder of Women in Global Health, which is a nonprofit working to achieve gender equality in health leadership at the global, national, and local levels. Since its inception in 2015, Women in Global Health
Just checking with tech. Donna, are you there?
In your journal. As you wrote, in global health, we're witnessing an increased political commitment to civil society and citizen engagement in the shaping of policies and plans, including international institutions such as the WHO. So let's hope that that commitment doesn't get lost here in the United States. And I turn it over to you with my thanks.
Great, thank you, Donna. I'm really grateful to Physicians for Human Rights for hosting this important discussion on the relationship of the United States and WHO and really inviting me to moderate. Again, I am the Executive Director of Women in Global Health. We are a global network of women in health and allies really working to achieve gender equity in global health leadership, particularly around ensuring women's representation in decision-making. We also advocate a lot around decent and safe working conditions for women who are the majority of the health and social care workers on the front lines of healthcare delivery. So it's really great to connect with your community and all of you as we have this critical discussion. And as Donna, you've highlighted, the current COVID-19 pandemic makes this a most opportune time to be discussing global health, health security, and multilateralism. We know that COVID-19 has exposed deep inequalities between and within countries. And as the economic impacts grow in magnitude, we expect those inequalities to deepen. We also know that pandemics do not respect national borders, and COVID-19 reminds us of our common humanity and also common vulnerability. None of us will be free of this virus until it is controlled everywhere in the world, and this is why exactly partnerships and multilateralism matters so much. For many who might not know, the WHO was founded in 1948. The US government had a critical role in both founding the UN and WHO. The World Health Organization now has 194 member states. And some of the things it does is coordinate global response on a wide range of issues. Some of these issues range from promoting health as a right for for all of us and coordinating the response to threats to our health, but also livelihoods as well. It develops policy and improves access to quality care. And some of the achievements of WHO, which just to kind of show the power of this organization in the past decades, it's eradicated smallpox, which has killed 300 million people in the 20th century. It's leading the response on polio, which the United States has been a critical driver of. And more recently, WHO during the COVID-19 is coordinating the ACT Accelerator, which has over almost 170 countries have joined into this process, the global effort for supporting the development of testing, treatments, and vaccines of COVID-19. So the US's announcement, particularly to withdraw out of the WHO and putting it into action by July 6, 2021, will have implications domestically and globally. And on that note, I'm really excited to introduce our expert panelists for their views on the implication of a US withdrawal from WHO. We're joined by three esteemed panelists who have been, again, engaging with WHO, thinking about global governance, thinking about public health, both at the global level, but very much at the domestic in the United States or domestic in other national contexts. We're joined by Georges Benjamin, who has served as Executive Director of the American Public Health Association since 2002. A role in which he serves as one of the United States' most influential physician leaders. He formerly served as the Secretary of the Maryland Department of Health and Mental Hygiene. He is board certified in internal medicine, a fellow of the American College of Physicians, a fellow of the National Academy of Public Administration, and holds many other titles and is engaged in many committees related to public health and also worked in TB as well. We're also joined by Lawrence Gostin, who I'll be referring to as Larry in this conversation. He is a university professor, director, and founding chair of the O'Neill Institute of National and Global Health Law at Georgetown Law School. He is a Georgetown University professor of medicine and a Johns Hopkins University Bloomberg School of Public Health professor of public health. He serves as the director of the WHO Collaborating Center on National and Global Health Law and also brings expertise of interacting with the United Nations and WHO in many different ways. And last but not least, we're also joined by Abera Okere. She is a public health physician with over 25 years experience in communicable diseases and global health security. She currently leads Public Health England's UK-funded International Health Regulation Strengthening Project. This provides technical assistance at enhancing capacity for compliance of the international health regulations, which are critical to health security and including strengthening public health systems in countries such as Sierra Leone, Nigeria, Ethiopia, Zambia, Pakistan, Myanmar, with Africa CDC and WHO. So really providing us a perspective that goes into the implications of WHO beyond the United States. So really very excited for this panelist, but a little bit of housekeeping before we get to talking today is I really encourage all of you to use the Q&A function to really raise questions, be provocative. The three experts that are joining us are thinking deeply about these issues. And so we really want to hear from all of you on, what are the questions that matter? What are the issues that matter the most to you? Please engage us on social media and tag Physicians for Human Rights. And again, let's use all the different ways to connect today to make the most of this time. So I'd like to first kick off by actually asking Larry, Larry, you bring a global governance perspective into really understanding, WHO and US's role, not just in the short term, but in the long term. America is currently WHO's largest single donor. And if America withdraws from the WHO, who will step into the political and financial space left by the United States, and what impact will that have for global health?
Well, thanks very much, Rupa, and thanks, Donna, and Physicians for Human Rights. I think PHR is just the most amazing, wonderful organization on this planet. So thanks for all you do. First of all, I think you said this, Rupa, but I just want to make it clear. Under the WHO Constitution and also under US law. The United States joined WHO in 1948 under a joint congressional resolution. And that resolution provides two preconditions to withdrawal. One is that we have to pay up all the money that we owe WHO, which we haven't done. And the second thing is that we need to provide 1 year's notice. And so, you know, in between now and the expiration of a year, we'll have a presidential election. And so it's by no means certain that the United States will withdraw. If we do, I do think it would be a ruinous decision. You know, why? You know, part of it is the money, of course. The United States is the largest single donor of WHO. And if we left, the largest then would be a non-state actor, the Gates Foundation, which would not be ideal for an intergovernmental organization. And so WHO is already terribly underfunded. It actually has the budget of around one large US teaching hospital, 1/4 of the CDC, and yet it has a global mandate. But even worse, WHO's budget is controlled by external donors, including the United States, that earmark funds. And so literally, WHO only has about 17% of its budget, already a small budget, within its own control. Having said all of that, I spoke with Dr. Tedros, the head of WHO, just a couple of days ago. And he told me, he said, Larry, you know, it's not just the money. I mean, you know, we can make that up. It's the United States' engagement, leadership, all of the things that the US has meant to WHO and global health leadership for such a long time. You've mentioned smallpox, polio. I could mention many, many others, including President Obama's response to Ebola. So truly, it's about the money, but it's not just about the money. Already, mostly European nations, but also China and other countries have filled the gap in terms of funding. So, you know, this is ruinous. I think it's bad for United States security. I think it's horrible for global solidarity and what it stands for. And it makes me extraordinarily sad to think, you know, Eleanor Roosevelt with the right to health and human rights and the US role in bringing WHO as the first specialized agency of the United Nations, to see the United States threaten to withdraw and particularly at this time when we're experiencing a once-in-a-century pandemic, is just beyond sad, but it's not irreversible.
And Larry, you know, you touch on some really critical points. You know, one, really how destabilizing it can be and how the power will shift dramatically once the US pulls out within WHO. So I think there's definitely more to unpack on what this would mean with the US leaving, who's going to step in.
That's right. That's a very important question.
And exactly what does that, you know, what does that mean? How will this change the global architecture? So I do want us to, you know, touch on that a little bit more. But before we get to that, you also alluded to, I think, the most critical issue is the thought leadership. The United States and Americans have been very engaged in the World Health Organization as technical experts, shaping guidelines, of course, in health security, but also in non-communicable diseases more recently. So I'd actually like to turn to Georges, who's had experience working, you know, particularly in some of the technical expertise and seeing the implications of having WHO guidelines as public health gains in the United States. The United States has some of the best medical research institutes and medical schools in the world. With all the resources and knowledge at our disposal, what would the United States lose if we withdrew from the WHO?
Thank you, Donna. You know, one of the most important things for everyone to remember is public health is a collaborative activity. And interestingly enough, even though we scientists go into our labs and do our little research in mysterious ways, turns out that science is also a collaborative activity, because we do what we do and then we put it out there in the world for critique, and then others emulate what we do. And they say, yeah, that worked, but this one didn't work. And it's an iterative process until we understand the very essence of our existence and the way the world works and how we can improve health and well-being of people all over the world. And so this collaborative activity, if we didn't have a World Health Organization, we'd have to create another World Health Organization. Because if you actually think of what happened with COVID-19, it was the fact that we had scientists that knew one another, that had been collaborating for years, generally through the mechanism of WHO, who were sharing genomic structures, who were getting on the phone at the middle of the night and saying, hey, you know, what do you think about this? And what do you think about that? And it wasn't just for SARS COVID-2, it was with SARS-1. It was with polio, it was with smallpox many, many years ago. So the fact that we don't have this, and the fact we have an extraordinary scientific engine in the United States, which I would like to argue is the economic scientific engine for the world, but the rest of the world is part of that. They're part of that, and they're so closely intermingled that if we did not have this collaboration, quite frankly, we would do it someplace else. And WHO is the place to do it. It's strategically linked to its other regional offices. So, for example, if you think that this is something that's very Eurocentric, don't forget about PAHO. PAHO is the regional office for WHO, and I have to admit, of course, it's even older than WHO, right?
Yeah.
But for our region, and it does exactly on behalf of WHO the same kind of coordination for our region. So we're so closely linked that it would be a tragedy, as Larry pointed out, for us to do this. And quite frankly, we would just spend the money, effort, and time and have to repeat it all over again in a much more inefficient way.
And I think, George, as you're really touching on the fact that there is a pragmatic role for WHO, it was not just created because of it being a bold, great idea, but it's actually for science, for public health, and really just regardless, we need to coordinate across borders for health and well-being. And so I think, that message is a really clear and strong one. And I want to turn to Abere to really, give us insights and perspectives that, as Americans here talking, we know that the investments that the United States puts in to WHO has broader implications to societies all around the world. What would you say are the greatest health threats currently facing low and middle income countries, many of those that you're working in, and how does the WHO support countries in addressing those threats?
Thank you, Rupa, and thanks to Physicians for Human Rights for having me. And this is a really interesting opportunity to talk from the perspective of the countries that I work with. And before talking about what the health threats are that they're facing, I wanted to follow up on Larry and George's comments about the value of WHO. It has 150 offices in 150 countries it is represented, and it has its specialist collaborating centers. So like George said, we need those networks. Human beings work better in networks, in partnerships. And in lower middle income countries in particular, WHO doesn't just provide the normative function that it does for, say, in Europe or in North America. It also directly is involved in supporting the health systems and the public health structures in those countries that it works with. It is a true partner to the those member states that don't have the infrastructure, the systems, the resources to develop all their own systems. It supports them until they can stand on their own 2 feet. So before talking about what the impact would be for them, I want the biggest impact as I see it of the decision of the US to withdraw is trust. is loss of trust in WHO. The US is a thought leader globally. People look to the US for direction around the world. And if the US says, we don't trust the WHO, that message will cascade to countries that, in my view, don't actually have the privilege, the luxury of taking that decision. And that impact will be far more significant than just the WHO being underfunded. Like has been mentioned, funding can be found elsewhere, but trust is a critical part of a functional public health system, and WHO is the core of public health systems in a lot of the countries we work with. And then to answer your question, low middle income countries are huge and they're diverse, and their needs vary as from very extreme, very low income countries that WHO works with from the very foundations to the low income countries that have very significantly developed public health systems, and their health needs and their priorities at the moment will vary from endemic diseases that some people in the West don't think about that much anymore, to the epidemic diseases that we're talking about all the time. And of course, considering the epidemiological transition, non-communicable diseases and the diseases of aging are becoming an increasing issue for a lot of countries that don't have very resilient health systems. The WHO has a function in that it actually helps to translate the body of knowledge that the world creates into the context that these countries need, adapting it to their circumstances. So like Georges says, I have to agree, if we didn't have the WHO, we would create it. Doesn't mean it's perfect, but we need something that serves that purpose. And there are other international organizations that are contributing to the public health dialogue and to the system, and they have value, and we need a multiplicity of partners, but there is a value in that single organization that all nation states in the world are part of and engage with.
Yes, and Abera, you're touching on a really critical word there, and value, trust. And, wanting to come back to actually Georges to react to this, even if we as the United States walk back on the decision to withdraw, some damage has already been done, at least symbolically. Do US commitments to multilateralism matter still? And how does this impact our responsibility as global health and human rights advocates to ensure the US never considers a decision like this again? Clearly, trust has already been broken.
We have the same challenge happening in our own country, where we've had enormous trust broken. We've had a lot of polarization. And by the way, it's not just the US. We're seeing this kind of polarization all around the world. And I think what we've got to spend a lot of time looking internally and externally, and making sure that we build a community that understands that it's not just about me, it's not just about you, it's about us. And it's the we, it's the us, it's the collective, the collaboration that occurs, because we're in a society now where we are, information moves at the speed of electrons. Also, disinformation moves at the speed of electrons and creates distrust. We're in a world where disease, we're only one plane flight away or one train flight away, depending on where you are, from something very bad being transmitted from one community to another. And yet, we're one planet. And so we really have to, I think, step back as a society of nations and realize that every nation on this planet has value, and that we have to work for common goals to achieve those kinds of things. So what happens as we go forward over the next few years? I believe we're going to have to do a lot about rebuilding trust. I think we're going to have to go and talk to our friends and colleagues around the world. And by the way, there are a couple universal languages on the planet, and one of those is science.
Mm-hmm. Great, thanks, Georges. And I'd like to come back to Larry to, unpack a little bit about the funding landscape. There are, a few questions coming in about, does the U.S. government actually have the ability to implement the decision that they have made to withdraw from the U.S.? What role does Congress have, and can Congress overturn this decision? And so, this is something I know you're closely following, and please inform us on what is really possible with this decision.
Yeah, I mean, that's interesting. Harold Cole at Yale Law School and I have had some articles, where we, in Foreign Affairs and other places, and Donna mentioned the Lancet article as well, where we question the lawfulness of the decision, because our argument is that since the president was authorized in 1948 to join WHO under a joint resolution of Congress, we need that joint resolution again to withdraw. And we're exploring with certain NGOs the idea of litigating this. And of course, at Georgetown at the O'Neill Institute, we are a WHO collaborating center. And so we would have standing because we would be harmed by it. It's unclear. I mean, the president does have wide-ranging powers in foreign affairs. I think it's been unwisely exercised, and we do have a very conservative Supreme Court with a now a 6-3 conservative majority. So the truth is we don't know, but I think that Congress must have a say. Congress, if we were to withdraw, Congress really should continue to allocate money to the WHO. And I think if they did, the president would be obliged to spend that money for the purpose for which Congress allocated it. But it's a mess here in the United States if that were to happen. I'm hoping that we will undo the notice of withdrawal, and then get back to the issue of, that my co-panelists have said about, building trust. The United States has lost a lot of credibility in the world, and particularly with our allies. Our allies, in Europe and other places in the world just are, it's a bridge too far for the United States. And so, there's a few things that we would need to do to start to repair what we've done. One of them is to rejoin the Paris Agreement on climate change. The other would be to join the World Health Organization or not withdraw. And the third would be to join COVAX and the ACT Accelerator that you mentioned, because right now, virtually all countries in the world are members of COVAX. They've given funding to it. It used to be China, Russia, and the United States that were the outliers. China has now joined. And so to me, this is a huge symbol of global solidarity that, if it's true that all lives matter everywhere, then we need to have an equitable access to a COVID vaccine and therapeutics everywhere in the world. WHO is working to do this, but at the same time, the UK, the US, even Canada have started buying up advanced supplies of many COVID vaccines. And that's not a good signal for global solidarity. And you know what? It actually might hurt us in the United States. Why? The reason is that we're gambling with American lives. We're assuming that the American vaccine is going to be first and best. It probably won't. It'll be second. I see George is smiling, which always means it's a good thing. It's likely that second or third generation vaccines will be quite a bit better. And if the United States hasn't been a global citizen and these are vaccines that are developed in China, India, or even Europe, we might be on the outside looking in, last in the queue for vaccines. So, you know, it's also in our national self-interest to be good global citizens. And I really hope that Americans understand how important it is. You know, we are in this world together. If COVID didn't teach us that, nothing will.
And I want to give Georges a chance to react, and you know, especially I think that some of the questions we're getting in from all of you tuning in is, you know, how do we engage Congress? What can we do? There's a budget resolution that's set to expire on December 11th. Is there a way that we could, you know, address and potentially change if there's a change in administration? Are there ways for us to mobilize funds again to support WHO? So would love to get your thoughts on, you know, what can we do for those of us that are fully behind keeping a funded WHO from the U.S. perspective? Georges.
Yeah, so as you know, the way Congress always does when they extend these continuing resolutions is they always kind of do it right before Christmas for some strange reason. I think they it gives them some leverage in order to negotiate a deal in going into the next year. And that's just, they do that every time when they do a continuing resolution. And they will then either do several things. There are several futures. One is Congress will negotiate a continuing resolution that goes right beyond the presidential inauguration. And they'll do that, you know, in order to give this administration or a new administration the opportunity to think through their new budget, you know, as they put in their new programs and ideas of what they're doing. The second thing that's possible is that they could pass a continuing resolution to go through, you know, all of next year. That's unlikely to happen, but they could do that. One of the reasons they probably wouldn't is because, of course, what happens after the first of the year is we get a new Congress, and they would like to have that new Congress to put their stamp on the fiscal budget. And so all of those kinds of issues will be in play. I think we don't have to worry about the fact that a continuing resolution, you know, kind of ends in December, you know, the WHO will be in more jeopardy because of that timing. I think that what we can do is just make sure that we all advocate that WHO funding should be included in any funding proposal that occurs by any administration as we go forward. We should continue to advocate for that, because what's real clear is that we've often had administrations who have said they want to do one thing, and then because of the strength of advocacy, they have changed their mind. So we should not give up. We should not believe that this notice of withdrawal is a definitive notice of withdrawal, because the public, at the end of the day, we are a democracy. And at the end of the day, we do get to say what we would like to get funded. And we do that through our advocacy with our elected officials most strongly. So I would encourage people to continue with the budgetary advocacy and the advocacy that says we need to continue to have the World Health Organization.
Great points there, Georges, about there's still an opportunity to continue to advocate locally and really advocate to our Congress to say, let's, you know, still put the funding into WHO. So, you know, let's not stop as human rights advocates here and continue to push in that way. So thanks for that message, Georges. I'd like to turn to Abere. You know, one of sort of almost as a result of what the U.S. has announced, from your experience in different regions and contexts of the world, how do you view the impact of a U.S. withdrawal from WHO as also an opportunity? We know the Sustainable Development Goals has clearly set values that there needs to be a lot more country ownership. One of the things that the United States is notorious for in global health is claiming the agenda and monopolizing it. And some of the other perspectives that have come out on this is that, you know, with the U.S. removing, it might allow the opportunity for other actors that are usually crowded out to share their expertise and perspective. So would like to get your thoughts on this.
Right, thanks, Rupert. Yeah, that's an interesting, a whole big area, so we could talk about that for hours. We need to first of all be clear that the US government's investment in global health is not just through WHO. It does a lot of direct engagement, bilateral agreement, either through US CDC, through PEPFAR, and it is also a major contributor to some of the other either disease-specific funding programs and other international multilateral funding organizations and programs. But I'd like to quote John Nkangasong, who's the director of Africa CDC, who talks about a new public health order for Africa. And that was followed the back of the initially the discussions for an Africa CDC, a continent-wide Center for Disease Control, predated the West Africa Ebola outbreak, but that outbreak gave it additional momentum. And the African Union and all 55 member states on the African continent committed to the creation of Africa CDC. And through that body, they're driving very hard to improve public health systems in the country. One of their key mandates is to ensure that their national public health institutions, such as the equivalent of what US CDC, of course, not necessarily that large or that well funded, in every country, so that there is actually a system and a focus for public health priorities in those countries. Africa CDC is coming to its own in COVID, for example, and we've seen the improved coordination alongside WHO to improve access to essential resources for the COVID response, developing and sharing guidelines, and through their access to heads of state through the African Union to actually gain commitment from member states where WHO might be less effective in achieving that. So there is a change in the public health system worldwide, which I think is an advantage, because we need to recognize that WHO, the United Nations, came out of a different world from today. And so we do need to adapt and modify the systems that contribute to improving public health across the world. And I'll stress again that we still need a WHO, but there are complementary systems and additional systems that work alongside it. That means that if the US were to walk away from the WHO, it is not the end of the world. It will be significant, and let's not make any bones about that. It would be very significant, and more so in the countries that have low resources. The advantage as well that WHO has is that they can work in countries where bilateral arrangements may not be possible due to political or geopolitical or economical restrictions. So WHO works in countries where the US may not want to go for whatever reason, where the UK may be unwilling to go. And so stepping away and reducing its ability to continue to support those countries will have significant implications for all of us. And it's not just about those countries and the impact on their own populations, but like Georgia said, it's a global village now. You're one flight away from anywhere in the world. So if those countries can't cope, we're all at risk. And that is the whole foundation under global health security. But we do need to recognize that countries and states and their governments do have some responsibility and have been stepping up, I think, increasingly to deliver on their own responsibility to their own populations to improve their systems.
Great. And so, Abera, what you're really saying there is that the ecosystem has changed from when WHO was founded. There are many more opportunities that are being strengthened for having diverse perspectives in global health, and we're going to see more and more of that. So the US leaving WHO does not necessarily mean it creates more space for other actors, and actually having that partnership creates more opportunities for coordination across borders that wouldn't be possible otherwise. So I think it's quite clear that you're still saying, having the US involved is actually critical. I'd like to turn to Larry on some of the questions we're receiving is what arguments exist for leaving the WHO, and a little provocative here, but are those arguments valid, and are they in the best interest of the United States? We've of course heard a lot floating around about, it's in the best interest to leave.
Yeah, I mean, obviously I don't believe that it's in the US best interest to leave, nor do I think that it's, in the world's interests. But let me just go through the arguments that the United States has made. First and primarily, they've said that the WHO has been overly influenced, even co-opted by China, and that was part of the concern of the president. And so, if you look at that claim, it's not wholly untrue. I don't think China is at all influencing WHO any more than the United States or the UK or France or Germany influenced the WHO. WHO is an intergovernmental organization, and it's been a very firm part of its history now for over 75 years that WHO's director generals don't publicly criticize countries. There are many things the United States has done that could have been criticized, and there haven't been. The only time I can remember a DG openly criticizing a country was when Gro Brundtland criticized China during SARS-1. But it's not in the tradition, and Dr. Tedros took the judgment that he would push China hard behind the scenes, but not criticize it publicly. Quite frankly, the United States did the same thing with a lot of high-level praise of China at the same time. Now, if it were me, I might have done it a little differently. I might have said early on in the pandemic, listen, these are the data China is reporting. I can't independently verify those data. That would have been true. But it's not in the WHO tradition to do it. And I think second guessing WHO for the way it behaved is frankly unjust and unfair. More than that, the second part of the US claim was this, had we known earlier, we could have done something about it here in the US. That's palpably untrue. First of all, WHO did act quickly. They did declare an emergency very, very quickly. And secondly, we don't rely on WHO for our intelligence. We have a huge intelligence service. And it's almost laughable that the United States would say we relied on WHO when we have direct access to intelligence in China. And then finally, it's pretty obvious. I mean, you could see COVID-19 moving like a tsunami. You could see it, when it started in Wuhan. It spread to Hubei province, mainland China, East Asia, Europe, the United States. We had ample notice that this was really crucial. So I think that the claims, the specific claims that have been made against the WHO are unfair. I worked with WHO for 30 years. They can be maddeningly bureaucratic sometimes, but they are great people, hardworking scientists in other disciplines. Dr. Tedros is a man of enormous compassion. He's turned the other cheek, and just got on with the job. WHO, and since those first early days in China, when nobody was quite sure what was going on, WHO has acted admirably. And then just finally, this. Do we want to reform the WHO and the international health regulations? Absolutely. We want to make WHO more powerful, better funded. We want to be able to allow WHO to independently verify state reports by reforming the international health regulations. There's a lot we can do, but to walk away and not even be at the table for those innovative reforms is utter irresponsibility, in my view.
Yeah, and Larry, just as you're pointing out the reform aspect of it, and as you are in touch with Dr. Tedros, what are you hearing about WHO's willingness to learn and to respond? And what are some examples that WHO has acknowledged that it could do better?
Yeah, well, the main thing, of course, is that the World Health Assembly has voted to have an independent WHO inquiry into the origins of SARS-CoV-2 and WHO's role throughout. And so that's ongoing. It's got a really great panel, really great chairs, and they're looking at those things, including being in touch with the chairs and some of the members, the international health regulations. A lot will depend upon whether or not WHO has country support. Remember, after the West African Ebola pandemic, there were 4 major global commissions. I was on 2 of them, and I served the Secretary General of the United Nations on another. All of us recommended major changes after West Africa, and the major ones WHO enacted, including its health emergencies program, which is now operating it did during the DRC Ebola, and now it's operating very robustly in relation to COVID, and also an emergency contingency fund, which WHO did do, but it's still underfunded. So WHO can be reactive. Don't get me wrong, getting the World Health Organization to reform is never an easy thing. Much of it is often put on the Secretariat and the Director General in terms of blame, but the bigger blame should be on the member states. We have structured WHO through our funding. I'm talking about governments like the United States, China, Europe, everywhere in the world. We have structured them to make it really hard for them to succeed. We have the WHO we deserve, but we should deserve and demand more. And to do that, we have to give it political backing, we have to give it legal powers, and we have to give it funding under its own control and sustainable. Those are the bottom lines. Any independent expert that's looked at WHO will tell you the same thing. I'm not telling you anything that all of my colleagues wouldn't roundly agree with.
Yeah, thank you, Larry, for pointing that out. And I think, it's a clear message. You're saying WHO has always been open to reform, but we have to also ground it in the fact of what are we investing in WHO? Are we giving it enough political power? Are we giving it enough legal and governance ability and financing the mandate we give it? And Dr. Tedros himself has been a strategic reformer, and sounds like there's been a lot of willingness by WHO and the World Health Assembly and member states to learn and reflect. And those are always, I think, critical aspects. I want to, we're coming to nearly an end, but I wanted to circle back. We're getting a series of questions, and Georges, there's, one question that's really coming to you about, can you tell us what APHA is doing to mobilize its members to address this particular issue about the US withdrawing its support from WHO? And can you also let us know what does this mean for the relationship that the US has with PAHO, as you had talked about the Pan American Health Organization as well?
Well, let me start by saying that one of the things that I learned very, very early in life, and have learned in many of the administrative jobs that I've been in, is that old saying that says, if you're not in the room, you're on the menu. And so it's very important for the United States to remember that, that if we take our ball and go home, why would anyone want to play with us in the future? It is extraordinarily important that we also understand that a strong African continent and other strong regions of the world are in our best interest. Because if those entities can improve their capacity for health improvement and governance and engagement as a collective, then it makes it a lot easier for us as an entity to work with them in a coordinated way. So we have to recognize that we should not be afraid of other parts of the world strengthening their capacity to engage in health and public health. That brings us to PAHO. PAHO is also an agency, a regional office of WHO, which has also been underfunded and undersupported. And in fact, one of the largest folks that do not pay their dues is the United States. And we have not paid what we owe them for quite some time. So we need to, first of all, stop being a debtor nation, pay what we've said we're going to pay, and then participate as a collaborative partner and not a bully. And have we been a bully at times? Absolutely. I think leadership is very important as part of this process. So at least the American Public Health Association is trying to provide the advocacy leadership for us to fully fund what we've agreed to fully collaborate and partner as an equal partner with other parts of the world. That is both with the continent of Africa, that's with Asia, that's with the folks in our own region, both the Caribbean and South America and the rest of North America. And what I'm hoping is that over the next several years, that our nation will wake up and realize that if we're serious about solving these public health problems, then we have to act differently and behave differently and provide the leadership that I think everybody else in the world expects us to provide.
Thanks, Jarvis. Really great point there. And Aber, I'd like to turn to you. Really, there's tuning into as the United States, we're really trying to again think about the decisions that are being made. What are you seeing as again the political commitments? Particularly around universal health coverage and sustainable development goals. If the United States leaves the World Health Organization, what do you think it will do for some of those commitments that the US has been part of?
It won't change those commitments. It may make it harder to achieve them, but these are universal commitments. It's not just the US. The UK, for example, where I work, and most of the European Union are very solidly behind the WHO. And this isn't blind support. There's a recognition, as we mentioned, that there's reform, there are improvements that can be made, not just to WHO, but the instruments through which it works. We can restructure WHO, but then we also need to empower it to do its job. So in Europe, there is strong commitment for taking that global approach and a collaborative approach to some of the sustainable development goals and to universal health coverage. That is a very, very strong ambition and the focus of WHO's engagement now, and I think rightfully so. One thing that the COVID has taught us is that even high-income countries with extensive and resilient health systems can struggle in an epidemic, and universal health coverage has the advantage of ensuring that the foundation of a health need, health as a human right, which we all talk about and WHO expounds, is actually accessible without it causing significant economic pressure. I have the privilege of being in the UK, where we have the National Health Service, and that is as close to a universal health coverage program as there is. It has its challenges, and just like WHO, it is a huge bureaucracy that also needs to be refined and improved and adapted to the 21st century. But that commitment is there, and whether the UK, the US are within the WHO family or not, I think that the movement will continue. And I also like to think that even if they are not a part of the WHO, that the US will continue to engage in the dialogue in those commitments it's made, because, as has been pointed out, it's in our mutual interest that we're all part of this conversation.
Great. Thank you, Abera. And as we come to close, last question for Larry and Georges. What advice would you give to whichever candidate that wins the 2020 election, which is days away, in reference to funding the WHO? Should they reconsider the funding amount? What's your one advice? And please, if you guys can keep it concise as we're minutes from closing. So maybe kicking it off with Georges and then Larry.
Withdraw the notice of withdrawal.
Perfect. Larry?
Okay, I'll add to that. Fight for an increase in WHO's mandatory assessment. Congress allocate robust, sustainable funding for WHO, support WHO and IHR reform, and join COVAX and do it robustly.
Great. Really, I think that's exactly the messages we really need here. If anything, today's conversation has showed us the 21st century shows us that we do not live in a vacuum. We're all interconnected. Science is about collaborating. We've heard clearly that it's bad for us in the United States if we leave. It's gambling with lives of Americans. We've heard that it would be horrible even to the point. And, just really closing on a positive note, now more than ever, we need global cooperation and collective action. And that's only something that the UN and WHO can facilitate. And on that note, I just want to say again, thank you for tuning in, and thank you for Physicians for Human Rights for organizing this and bringing all of us together. We know there's much more to talk about, but there's a huge opportunity to take action. So please use this as one of the conversations to keep yourself informed and continue to engage in advocacy through this platform and other platforms. So thank you to our speakers and panelists for joining in, and I'll turn it back to you, Donna, to close us out.
Great, Rupa, thank you so much for your really brilliant moderation. I think all of us could have stayed on this discussion for much longer. It was riveting, and Abire and Larry and Georges for sharing your insights with us, for helping us to understand the role of WHO, its importance, and what's at stake if we weaken it through a wholesale withdrawal of US participation. As Georges so rightly pointed out, if we didn't have a WHO, we'd have to create one. So thank you for making that point. The WHO is in a position to push for solutions that are for the collective good, to push toward our common goals and recognize our interdependence. So you all gave us so much to consider, and you gave us our talking points for advocacy. So thank you to the panelists for emphasizing that we should not give up, and that public pressure via advocacy is what is going to correct what would be a disastrous mistake, or prevent it, and especially during a pandemic. And what a board member and Lancet editor-in-chief Richard Horton cautioned during a previous PHR webinar, this is going to be one of the greatest challenges our species will ever face. So the implications of this decision are enormous. Thank you all for attending today. This is, as I said, the 29th in PHR's webinar series, so I hope you'll tune in for more. And one thing that the audience can do as an important step in advocacy is you can share this video that you can find on social media and on PHR's website. Share it with people who would find this of interest and are in positions where they can take some of the actions we talked about today. So thank you for supporting the advocacy of PHR and others who are doing this really important work during a global pandemic. So thank you all, and stay safe.
Bye, everyone.
Bye. Thank you.
Well.
Bye.
Thanks, PHR.
Thank you. Bye.
Thank you all.